So, now this is particular place she have some kind of problem. Now, what is here? We know that there are ribs, and there's a joints and the ligaments.
Ok, sabemos que el problema está en esta área y lo que hay allá son costillas,
yeah.
ligamentos y articulaciones
And the muscles.
y muslos.
Yeah. So now, most of the time, what I usually do is to find out which part, because she said is my upper back, but I need to be specific where. So the first thing I like to do most of the time is just to do this. See? Immediately. I always say human body never lie, just tell you where it hurt.
Lo que él hace al inicio es identificar específicamente dónde está el problema y ya lo identificó. Él dice que el cuerpo humano nunca no dice mentiras.
So
cuando le toca, si hay dolor, ahí está el problema.
The moment I did this, I knew which one. And it's this one here.
Al hacer eso, ya identificó rápidamente dónde estaba el problema.
Now, how to recognize it? You need to practice a lot, many years. It will come. Don't worry. So, and then first I need to feel the mobility of the rib cage. Okay.
Tiene que sentir la movilización de las costillas.
Yeah. So that's the first thing I check, the ribs. And then I want to check the vertebrae, which one hurt. So now in this case, I'm going to activate the upper thorax movement. Okay? So I'm going to take here, no, this.
Está verificando cuál vértebra
Here.
ahora.
No. Here. Pen here. It's right the same because this was the rib which he had pain with, but at the same time in the facet joint is that's where the mechanical problem is. So it's this way.
Entonces fue en la costilla donde tenía el dolor, ahora es la articulación
Sí.
facetaria donde tiene el problema.
Right there. But see what is interesting. This is on the left side. Let's check the same joint on the right side. Okay. So here. Any pain?
No.
So now the pain is coming from this rib, but the attachment is there. So it's the same place. One is going there and one is going that side. So now we know where is the problem. Okay.
Entonces han identificado que está al lado izquierdo del paciente, ¿no?
So now how to start treating this lady? If you're going to do massage, it's not going to work because you're working on the muscles, but the problem is in the joint.
Ahora si vas a hacer masaje, eso va a ayudar a los músculos, pero no es el problema en este caso. El problema está en la articulación.
So how do you treat that? You just really start mobilizing one by one.
Ahí comienzas a movilizar vertebral por vertebral. Así comienza el tratamiento.
So this is called mechanical pain of the joints.
Es dolor mecánica de las articulaciones.
If I do this in the next 5 minutes, the pain will stop.
Haciendo eso en 5 minutos va a comenzar a desaparecer el dolor.
Now what is happening naturally is you stretching the deep ligament we're talking about. If you look behind you, you will find those particular ligaments. And so we're looking at this point, we're looking at this particular ligament where the ribs are. And so I was stretching this one here and stretching the rib. So this is the one I was focusing on. Now I am going to focus on that.
Él está estirando los ligamentos y aquel ligamento es donde está enfocando.
So this is a lateral flexion, and then I'm going to do the rib ligament. So how do you get there? Basically, I'm going to put 3-dimensional movement. So as you can see, I have this movement now. So how I'm going to do the rib is just to stretch it.
Está estirando el ligamento de la costilla ahora.
See, the spine is here, but I'm far away. So this is really a nice way to mobilize the whole rib.
Está movilizando la costilla.
Because once you do, what's happening, I am taking it that way, but I'm stretching the rib this way. And so in between, actually, I'm pulling the rib away from the position. There you go.
Con ese movimiento está estirando la costilla, ¿no? Y el ligamento.
So this is how you get the thorax mobilization. Remember, I will tell you that This is only one bed in the world which do the thorax mobilization.
Es la única camilla que hace la movilización torácica.
You will not find this bed anywhere, and I'm so happy that you're first one to witness it, how we can mobilize this particular place. So again, you see, I'm working on more ligaments, not so much muscles.
Ahí
Muscle will respond anyway.
está trabajando los ligamentos, principalmente no los músculos, pero los músculos van a responder de cualquier manera.
So this is how, and then you can, once you do the rotation, you can also hold the vertebra in a position and then stretch straight down.
Ahí está sosteniendo una vértebra y estirando.
So
hacia
when I
abajo.
do this, I'm holding one vertebra, the spinous process, then one below is just you stretch it out.
Entonces ataja un vértebra y lo abajo de su mano está estirándose.
Just come and try. No, just come and try this. Have fun. So let me just, first you start with lateral flexion. So just go sideways. Just enjoy that. This way, just go that way first. Stretch it and push it right in the center. Just feel how it feels. And then you can move from one place to another. You need to feel that.